Good morning, friends. I'm going to talk a little bit about breathing again. I have already explained you why we breathe. We are primarily breathing because through our lungs, this breath comes to our blood. It detoxes our blood. Through the blood, the oxygen reaches mainly the brain and the rest of the body. We discussed about the abdominal breathing, chest breathing, shoulder breathing, and how we can increase breathing levels. In the same breath, the volume air that we intake and offtake, how we can raise the volume twice, thrice, so that our blood gets more oxygen. Another concern that I have is about mask. These days, we are being advised that we should have, like if we are wearing a cloth mask, then we should also have at least a surgical mask and the entire N95 mask. So the N95 mask is recommended, and they generally advise that all this area should be completely closed, so that when we are breathing out, the aerosol is not pushing the infection into the air. This is perfect. There is no difficulty, but I am concerned that the intake of air in the body, how are we going to get fresh air when we are breathing in? So breathing out, we are not letting the used air, carbon dioxide, go. It is trapped inside. And then we breathe in, so the same air is being inhaled again. So this, in my way of thinking, will be actually giving more damage to the person. And I'm just wondering whether this is not one of the causes that is lowering the oxygen levels of patients in corona infected patients. So therefore, my suggestion is, if a patient especially, is in isolation, and happily if you have a separate room to yourself which has a window, then I think if the window is left open so that there is fresh air in the room, and you should perhaps leave your nose without the mask cover so that you can freely breathe in and breathe out. But those who do not have such facility and in home isolation, such people, in my opinion, must from time to time, every 2-3 hours, come to maybe a window or a door or wherever there is a possibility to breathe in fresh air without mask, or mask only on the mouth and not on the nose, so that you have every short intervals you are recharging your blood with fresh air. So this is a concern which I have. I had discussed this last year also, but last year I was advising freely to people that keep your nostrils open and keep the mouth shut with the mask, because that time it was that the infection is spreading. The another main thing is, why is our body immunity going down? Do we have certain precaution measures, preventive measures inbuilt in our nostrils as also in our throat? And I must say that the good news is, yes, we have both in the throat and in the nostrils trapping mechanisms that traps all kinds of infection. And in yoga, we have what is called Shat Kriyas. Shat Kriyas are 6 different procedures that are applied every day, and through that we are able to resist any infection in the body. In fact, we maintain body in normal health, or we can say we prevent any infection or any cause for ill health. So I will be discussing that in a separate video where we will focus on Jal Niti and gargling. That way we are maintaining both these passages in such clean situation that the infection cannot actually go beyond these traps. So in a way, we can prevent this corona infection. Thank you.